Leukemia and Lymphoma Society, we offer a caregiver workbook package um, that they can ask for free from the moment of their loved one's diagnosis. We have one geared toward parents of a child and one for adults, taking care of an adult. We have a weekly online chat for caregivers, and so we try to fill in all sorts of supportive things to help the caregiver.
Fantastic. Thank you, Sharon. Zach, from your side and the kind of organizations that you work with, are there any kind of resources that you find are most used for the caregiver or carers, or any other resources you want to share with the group?
Yeah, that's a really good question, Beth. I think it's a really important topic and one that often doesn't get enough attention as well. So I think most of the services that we provide as support charities are often applicable to carers as well, in terms of, for example, our counselling fund that we have in Leukemia Care in the UK is used by carers and family members as much as it is by patients themselves. But one of the things that we probably need to do a better job of as patient organisations is around the language of some of the way we talk about these services as well. Mostly they're targeted towards patients, or at least patients first. And not a lot of resource necessarily goes behind explaining how these services are available for family members as well, or it's sort of a secondary audience in many cases. I mean, we have, for example, information guides specifically targeted towards carers, but that's sort of part of an offering rather than necessarily thinking about carers throughout all of the activities, even though most of those are suitable for both patients and carers. So it's something we've done quite a lot of work to try and address over the last couple of years. But certainly more needs to be done by ourselves, by others, in terms of tailored offerings, as well as just making sure all of the narrative around the promotion of those services reaches everyone who might want them. And particularly when we're talking about carers, a lot of people don't necessarily identify as carers. So reaching and accessing that support is really important too. Not like the formal paid carer role is often not what we're talking about here. We're talking about friends, we're talking about family members, and whether they would identify themselves as a carer or not. Is actually the language is sometimes a barrier to accessing this support as well.
Yeah, thank you very much, Zach. That's a really important point. Thank you. James, from your perspective, did you have a, I guess, primary carer during your time?
I had both of my parents that I was very lucky that they were both able to have support from their work and have time off to look after, support me, take me to appointments. But it was I don't know, it was quite a few months in, and I'm sure he wouldn't mind me saying that my dad had a bit of a nervous breakdown about all of it. I think it all just built up, especially with, his work eventually when he started to have to go back completely full time. And then also dealing with my treatment didn't stop for, as a year of pretty much in hospital treatment. So seeing me go through some of the worst stages of my treatment, so when having high dose methotrexate, going through much more of the IV treatments that kicked me to the curb, so to say. That was when he was returning back to work. And so not only is he dealing the stresses of going back to work, but then also seeing me be in the worst state that I'd been in, I think does really take its toll, especially on parents and primary caregivers. Seeing any young person going through that is going to have a mental tax. And I think not one that's also concluded just with treatment, I think. And I guess if you've never experienced some kind of long-term health condition, seeing your child go through it is probably quite surreal. That you think it's something that would happen to people of an older age, not something that happens to young people who are supposed to be rubber and bulletproof. And then you find out, oh, things can still go wrong. And so it's quite a shock to most parents.
And did you find that there were any resources or anything that helped your dad through that period, or anything that you think you'd want to recommend for another primary caregiver in that situation?
Yeah, for I forget, it was Click Sergeant, but it's now just Click. And Teenage Cancer Trust. I think they had the lads and dads group, where again it was just a lot of dads that got together to have a conversation with each other to talk about struggling. Men's mental health Agorst needs a lot more support, and I think it was a really good resource. That and the youth care support workers that were on the wards were always really good, really attentive to not only the patients but also to the parents too. Whenever people needed a conversation, they would just take them off for a chat to one of the therapy or one of the quiet rooms, just to actually allow them to be emotional and to feel that they were able to not just have to be steadfast for their child or the person that they were supporting, and they were allowed to be emotional about it themselves.
Yeah, thank you for sharing. Thank you. Michael, in your experience, have you, from the kind of caregiver perspective, obviously you interact with the patients, but you also have caregivers in those appointments with you. Do you have anything you want to share on that?
So there's no question that a diagnosis of a disease like ALL has a huge impact on families. Whatever your family might look like, whether it be parents or whether it be partner or whether it be your children or even grandchildren of some older people with ALL, this has a reverberant effect on the entire family and support network. And I think there's very little that really prepares families for this as well, particularly bearing in mind that often people with ALL have only had symptoms for a few weeks. So the families know that there's been something not quite right, but in many cases, the last thing that they're expecting to hear was that their loved one has leukemia. So I think often it's a really difficult time early in treatment when families are scared for their loved one. They're realising that often they're going to have to be taking some time away from work, which will often mean taking a bit of a financial hit. And this, of course, is happening at a time where they're frequently not getting a whole lot of sleep because they're worried. And oftentimes we find that there can be some disagreements within families around this time as well. So it really is a time where families need to have a lot of support. In my experience, the cancer support organisations have a really important role here, and they're often the ones who really help families because they've seen what they're experiencing in other families before and can help them work through some of these times. I think that one of the other particularly challenging times for caregivers, again, is when treatment finishes and even after treatment. And I think that fear of relapse is not just something that the individual experiences, but it's something which the family often experience as well. And it's not unusual, many years after the event, parents saying to me that they're getting on with life and everything's going well, but it still only takes a febrile illness for it to all come flooding back. And this is again where I think it's really valuable for families to link in with each other, share their experiences, particularly in the setting of organisations like the Leukemia and Lymphoma Association or various other support organisations.
Thank you so much for sharing, Michael. That's really helpful. I think you also touched a little bit on there around the kind of financial impact and also some of the kind of practical pieces of supporting and getting to appointments, the kind of financial burden of that as well. I just wanted to see if, Pete, perhaps if you had any thoughts on thinking of this from the caregiver perspective, did your primary caregiver support in terms of getting you to the appointments and any other aspects that you wanted to cover?
Yeah, so I was in a bit of a unique situation. As I said before, I was being treated in Bristol, and the rest of my family were down in Plymouth. So that was lucky in one sense that I had my mum with me at all times, and that I was in a they're now called Young Lives versus Cancer, and the Young Lives versus Cancer Home from Home, which was right next to the hospital. So that was made that side of things quite a lot easier. But I think speaking about like caregiver in terms of my parents, one of the things that maybe goes amiss is that when I was diagnosed with cancer, I was able to kind of drop my studies, all my responsibilities and everything. And as a parent, especially if you have other children, you can't necessarily just drop everything. So being a carer for somebody going through treatment, means that you're trying to kind of juggle that alongside looking after your other kids, looking after your house, you know, keeping home life going, taking people to school, and so with, for example, my dad, he was still working all the way through, and needed to play mum and dad at home, which meant for him, you know, needing to do a lot more of the, you know, day to day, doing the shopping, doing the cooking, doing the school run, that kind of thing, which is definitely kind of a practical difficulty for him, I guess, as a caregiver. But even though he wasn't the one who was there looking after me the whole time, but you know, you need that support network of people to spin all these plates, you know, that a lot of the time parents or other caregivers are doing. And at the same time, you know, that equally for my mum being up in Bristol with me, having all that worry about me, but at the same time worrying about everything she'd left at home. I think that's a big thing which isn't to be ignored.
Thank you so much for sharing. Yeah, really important points there. Around the kind of some of the practicalities, but also is that splitting the unit, I guess. So you've got your mum with you, and then also dad back at base looking after everyone else as well. Are there any other kind of comments or additional resources or anything that people wanted to comment around the financial and practical aspects from the caregiver?
My only point is that there has been, pretty sure there's a white paper that was submitted to the UK Parliament around like financial caregiver support in terms of cancer treatment, being able to access a pot of money. I think it's still ongoing, but it's this concept of traveling to and from hospitals, staying in and around hospitals for primary caregivers, and being able, not only necessarily just for cancer, but specifically around cancer, is that it's now understood even more than ever that the financial burden on parents is growing. And I think hopefully at some point soon there will be a pot of money available for people for when they're having to travel to and from hospitals, and to and from appointments. But I think it's something that definitely needs more work, and something that should be made aware to primary caregivers right from the offset, that it is going to have quite a financial impact, especially I think, as it was mentioned, without the ability to always be in work for quite a few people.
I think you're correct, James. I think that even in countries like yours and mine, where we're lucky enough to have universal health care, there is still that significant degree of financial toxicity from people taking time off of work, the costs of taking people to appointments, the costs of medicines and so forth. And I think it has sometimes been underestimated. And that's difficult, particularly if there's a young family who's got someone with ALL, or a young adult who might have just recently moved out of home and hasn't really got a job. So I think that the financial aspect is a really important one. I think one of the other things that we've touched upon in this conversation as well is the impact on other family members, not just the direct caregiver. For instance, the impact on brothers and sisters. And I think oftentimes when there's a child who has leukemia, it impacts the life of the siblings as well. And often they're worried about their sibling. They're not really sure what's going on. And I think that's another area where a number of the charities and support organisations can really step in to help out with how the siblings are coping with all of this as well.
So just touching on what James mentioned in terms of the financial impact, this is something, so a number of charities in the UK already provide sort of charitable grants. Obviously, these don't touch the sides necessarily in terms of the impact that people are facing. and a number of those charities. So there's Leukemia Care, there's Anthony Nolan, Macmillan do this, Young Lives versus Cancer, and one of the sort of strategies. So we're a welfare team at Leukemia Care. One of the strategies is to try and help someone apply for all of them. So if you sort of are able to access them collectively, they can make more of an impact. But exactly as James said, there's an ongoing campaign trying to get government funding for that. The cost, particularly of hospital travel, but also potentially higher energy bills as a result of undergoing chemotherapy and needing to keep the heating on. There's a lot, and spending more time at home as well sometimes. There can be a lot of different financial impacts, and not just for patients, but also for families. And most of these charitable grants are available to the families, not just to the patients as well. But definitely more needs to be done. And there's a big push to try and get that here in the UK. Again, even in a health system where everything's free at the point of access, all of these on costs around living with a leukemia diagnosis have a massive impact in people's lives.
Yeah, it certainly speaks to the importance of getting a social worker involved with patients' care fairly early on, particularly for young people who often don't have experience of the healthcare system. So my approach is to get preemptive social work involved rather than waiting until the wheels fall off.